Cord to the cloud.
And we're live, the Board of Health meeting of August 4th, and we are recording it for posterity. And I just want to find my agenda. Last meeting's minutes, is everybody okay with them?
Yes.
Yes.
So moved.
Okay. Okay, all in favor?
Aye.
I
Great, thank you. Just in the order of things that we have here, which is random. Lake Wyola Association has another membership meeting, and they're having it maybe next week or the week after, and they want to have it in person, and they're asking our opinion about that. I told Donna that I didn't think we could prevent them from having it in any case, but that we would talk about it, and if we had any recommendations to make, we would make them. She said the meeting usually draws about 40 people, and there's two ways they could do it. They have a tent outside in which they could have it, or they have the association building. And in the association building, they would just open up all the windows, which if you've been in that building, when you open up the windows, it's practically like a tent. I mean, the windows are all around, and it's quite open. And I wondered if we wanted to make any recommendations about this. I don't think we can give anything but guidance, really.
Tent is probably incrementally better for airflow, but they could do either one. They should be masked. And go ahead, right?
They should be
Marlene?
masked. As far as I understand, Wim, if they are outdoors under a tent, then there is no need no guidance about masking outdoors. But if they are indoors, technically, I understand it's a well-ventilated place, but if they are indoors, then unvaccinated people should be masking.
You don't think it's necessary for vaccinated people to be masked?
I think that
The state
everyone
guidelines.
is encouraged to mask
Right.
indoors,
Yeah.
but there isn't any requirement. So anyway, I think Wim is right that we should encourage masking
Okay,
if they're moving it indoors,
And regardless of vaccination status.
right?
okay. And if it's outdoors under the tent, what would we suggest? Should we say that we prefer the tent?
Sure,
Yeah.
that's the
And-
safest.
And what about distance? Should we ask them to try to keep people separated?
If they are indoors, yes. Households should be separate. I mean, people
Yeah.
from the same household can sit together, just like
Right.
anywhere, but the outdoor situation is currently if a person was exposed to a COVID positive, if they find out they were exposed to a COVID positive person, but it was all outdoors, then we don't count them. Masked, unmasked, vaccinated, not 3 feet, 6 feet, 2 feet, they don't get counted.
So if an exposure, you're saying if an exposure occurs outdoors, it's not considered a contact?
Correct.
Or, okay,
They're- Right.
oh.
That's been
Interesting.
true since June something.
Oh, I didn't know.
Mhm.
Okay. All right. So I'll tell Donna that they can do it either way, but we prefer the tent. That if they do have it inside, all the windows should be open. Unvaccinated people would be masked, and we encourage everyone to be masked. That's if it's inside. And I guess that's it. Yeah. Have I left anything out?
I think I would say it as if it's indoors, that all people should be masked regardless of vaccination status.
hang on.
if others agree with that.
Yeah,
Yeah, it's fine with me.
I think it's just a bit clearer that
yeah. And I think it would give that extra push to use the tent. Is what it would do.
Right. Yeah. Okay. All right, I'll pass that on. Thank you. So we've got a septic system repair for 6 Carver Road, and it's ready to go. They paid the fee. Charlie likes it. I don't think there's anything else to say about it. With your permission, I will go ahead and issue it.
Mhm.
please do.
Okay.
Yeah.
Thank you.
Now, 56 Wendell Road, that is Greg Steve's place.
Mhm.
We're not making much progress here. I got well, Charlie sent us a memo saying, referring to the order that he and Claudia sent them, that I'm not sure we had ever seen it before. At least I'm not sure I had.
Should we bring Wim, excuse me, but should we bring Wim up to date about what actions were taken on this
Please do,
property?
because I'm not familiar with it.
Yeah,
Okay, you know up near Town Hall, where that house burned?
Yes.
That's the house we're talking about. It
Okay.
belongs to Greg Steve. And as you know, it's been in bad shape for a long time. In the spring of this year, I guess, Charlie and Claudia, our agents, went up there and they discussed it with Greg, and they put a condemnation order on it, and they issued some orders for him to follow. And there are some parts of it that are not being, he's not up on. One of the items on the order was that the property should be secure. And although he's got, condemnation notices, no trespassing, he's got those gates across the driveway and so on. I think the problem is, and I forgot to check this with Charlie, I think the problem is that the windows aren't boarded up.
Yeah.
At least on the main floor. That's the only thing I can think of that would be required. The other thing is that he is supposed to have submitted to the Board of Health a timeline for demolition by August 1st, which is 6 months from the date of the order. And that didn't happen. I sent Greg an email about this, and I got a long, sad story about his health problems, which were apparently many and somewhat grave. The upshot, well, I heard that, and also I heard that people just aren't returning his calls. I mean, it's hard to get anybody to do any jobs. And so he's having trouble finding somebody who will contract with him to demolish the house. So at my instruction, basically, he has requested a 1-month extension of the order to submit a timeline for demolition. And at the end of the month, we'll see what happens. As far as boarding up the windows goes, that seems like something that should happen soon, but it doesn't sound to me like Greg is really able to do it. So
He probably could contract with someone just to do that, though, right?
he probably could. That's a good point. There's probably somebody who could do that, or he could get friends to help him do it. I've been thinking of asking somebody that I know that is friendly with him if he would be willing to assist with that.
Ken Rotondi is friendly with him.
That's exactly the person I was thinking of. You read my mind.
Yeah.
Yeah, I know that Greg has done a lot of favors for Ken, and it seems like this is a chance for Ken to catch up. So I was thinking I would call him and ask him if he could help him out with that project.
Or maybe help him find somebody. If Ken is
Yeah.
not in a position for whatever
Yeah.
reason.
Yeah, I don't know why.
There's also, I don't know the name of the organization. Maybe one of you do, but my neighbor across the street, Russ Greco, and I think Paul Lyons is in this group as well. And
Yes.
they do construction projects for people who can't afford to otherwise do it. They rehab houses. I don't know if that's something they would do, just board up windows, but they're all talented people. It certainly would be an easy job if the materials were on site.
Mhm. So,
Um,
I'm
Right.
sorry, is this I know you said you couldn't remember the name of the organization or the agency, but it's not what is the neighborhood?
Village Neighbors?
Village Neighbors. It's not Village Neighbors that you're thinking of. It's something more specific to construction related tasks.
yes, and it's
Okay.
not bounded by Shutesbury's jurisdiction. They go outside of
Okay.
Shutesbury as well.
So Paul Lyons is a neighbor, and I can find out from him what the name and contact information of the organization is, so that we could pass it along to Greg. I would
I ask-
not convey Greg's need to Paul,
Right.
but rather just get the name. Yeah,
And-
sorry.
I'm remembering that Paul was part of it, but I know for a fact Russ Greco is, and I can ask him. I'll probably see him tomorrow,
Okay,
so I can ask.
okay.
So with the boarding up piece, are we thinking a similar timeline requirement that it needs to be done within a month, or is this from our perspective something that is more immediate, that he has more time on the timeline for demolition, but
Yeah.
this is something that we really need to see happens for safety reasons?
Exactly.
Well, yeah, I mean, on the one hand, yes. On the other hand, it's been sitting there like that for like 3 years. You know,
And demolition kind of makes the boarding up of windows moot, you know. So,
well, it does, but that's not going to happen that soon. I mean, if he can get somebody to just enter into a contract with him within 30 days, he'll be doing well.
yeah.
So yeah, that's a good question. Greg is a lovely man, but he is a known procrastinator. I am thinking that we should issue an order ourselves. We can do it ourselves. We don't need Charlie to do it. Granting a 30-day extension of the timeline requirement, and further requiring that the windows on the ground floor be boarded up within, let's say, 15 days. And that way, if we have to expand it a little bit, I want to keep it shorter rather than longer, because I mean, we know who we're dealing with here, and it's gonna get stretched out.
I think I'm fine with that. I want for us to confirm that that the windows were part of Charlie's original order.
They weren't specified. He just said the building should be secure. Greg is claiming the building is secure. Charlie says it's not secure. I'm assuming, because I haven't checked this with Charlie, that the windows are the problem, because anybody could go around that gate and climb in the window. And I mean, presumably Greg was a dumb kid himself once, like everybody else, and can imagine the kids would just climb in the windows because they wanted to see what was there or whatever.
So if that wasn't specified in the original order, then I think that we should highlight that that's really what we're talking about, in addition to what he's already done.
Definitely, we'll make it very specific.
And Kat, was the
Yes, ma'am.
15 days that you referred to 15 from the date that this is issued, or 15 from the end of the 1 month extension?
No, from the time we issue it.
Okay,
So we'll give them, 30 days. Well, he was supposed to submit his timeline on August 1st. So we'll make it for September 1st. And let's make the Windows order, what's this? So like the 20th or so.
Mhm.
And then we'll see if he can do that. And we'll pass on whatever one or the other of you guys finds out about this group that could conceivably help him out.
okay. And what do we do? I'm just curious, if he fails to comply with this, what sort of authority does the Board of Health have for a person who continues to not comply?
Charlie suggested that if he doesn't comply, we take him to court.
He hasn't received a letter from the town attorney though yet. Has he?
No, what would that be?
I'm not sure, but that's usually highly motivating.
Right, yeah, I can see what you mean. I don't know how that works, because we've never taken anybody to court.
Yeah.
And Charlie and Claudia do that for us. We don't have to do
Yeah.
it. But I don't know anything about how it's set in motion and what warnings and stuff he gets and who he gets them from.
But Charlie and Claudia have been through plenty of that, so they know, I'm sure they know the different steps along the
For sure.
pathway.
For sure.
I just don't know it, that's all. Okay.
Right. I would, and I mentioned that to Greg. I said, Charlie suggested that if you don't comply, we go to court, and let's not go there. It doesn't seem like it would really be helpful, and it would certainly be traumatic for everyone.
Mhm.
So let's see if we can move forward. So if Arlene, if you and Wim will find out about this group, this rehabbing group, I'll contact Ken and see if he can help out.
Wim, if you first try with Ron, let me know if you get nowhere, and then I would follow up with Paul, I guess.
Okay,
Okay.
perfect. Yep.
Okay. All right. So PFAS testing. DEP is here in town going around doing extra testing. It's going on right now, today and tomorrow, and they're setting up some more testing. We have received a number of copies of results, but I still don't think that we are being kept up to date with the results that they have. The biggest news that you probably already know from next door is that there's a positive out Pelham Hill Road. And I've asked this Caprice Shaw, who is in charge of the investigation in Shutesbury, if there is going to be testing out there. And she said she thinks that they're going to also do some testing in that neighborhood. So testing is in progress, and we should know more soon. I had a long conversation on the phone yesterday with the person out Pelham Hill Road who had the positive test, and it was in the 30s. So it was over the limit, but it wasn't as bad as some. And this person has done a great deal of research, and she described a lot of it for me, and much of it is contradictory and confusing and stuff. And she is interested in having a next door group, an invitation only group for people who are interested, who are facing this problem personally, who have positives themselves and need to put in filtration systems, so that they can share information and share their experiences, what they do, who they talk to, if they put in a filtration system, how satisfied they are with it. One of the things that she told me is that there's two different kinds. One uses a solid carbon block and one uses granulated carbon. The granulated carbon guy says, oh, the carbon block is gonna clog up right away. The solid block guy says, oh, the granulated one is gonna channel, and so it's not gonna absorb evenly, and so on. So the whole thing is really pretty frustrating. So I'm thinking that I can set up for them, for people, a next door group that would not be open to just anybody. They would have to be invited. So nobody will come who doesn't have a specific personal interest in it, to just get up on a soapbox and rant and rave, as apparently people were doing on her other next door postings, which I didn't see. So I don't know anything about it. And I wondered what thoughts you guys have on this.
I think people might find it, some people affected might find it helpful. So I don't have any experience with this invitation only type of thing on Nextdoor. I didn't know it existed. But so the logistics of it would be you, as having the list of affected addresses, who would send out an invite, or how would anyone heading it up know who to send an invite to?
Well, I think probably the best way would be to send out a broadcast email saying, if you had a positive PFAS test and would like to be part of a closed Nextdoor group to share information, send me your email and you'll be invited to join it.
I see. Okay.
And then if I have people that I know are affected and I haven't heard from them, I could send them an email, a personal email, if I have their email or whatever, and
Okay.
ask them if they want to be included.
Okay. Sounds good.
Okay.
And did the individual on Pelham Hill Road indicate that they might be willing to be the facilitator and moderator of this, as opposed to
Us.
Yeah.
Yeah,
I mean,
who would moderate it, right?
Yeah.
The complicating thing that I see is that in putting out that message, do we fall prey to the argument that we've been hiding, that we're continuing to hide things because we've created this closed group? And I worry that we run into those arguments that we've encountered already related to PFAS.
That's a good point.
Which I would just add were inaccurate arguments.
Right. Yeah. Possibly, I'll talk to her again. Possibly what we could do is, I mean, I know how to do it, and she doesn't, but I could set it up and set her up as the group moderator, and it would be her responsibility to let people in. I would have to be on it, but then I could presumably get her to put me off it. Right, when she's the moderator, she could eliminate me. I would just be part of it as part of the setup.
I think I like how that sounds.
She should be ready to accept the fact that a moderator of any social media platform is sometimes faced with the task of cutting off inappropriate posts or stopping comments on a post that has deteriorated into you know, where just some guidelines are violated.
Mhm.
And
That's-
maybe they're responsible for developing the guidelines in the first place.
And I wonder if I'm drawing a blank on his name, the person who acts as the Shutesbury
Paul
moderator.
Flatch.
Yeah. You know, I wonder if he could be a resource or might even be willing to moderate that group.
That's an interesting thing to think about. I will talk to her again about it. I told her we would talk about it at our meeting, and I would talk with her again. And I'll see if she would be willing to do that. And I'll also look, I'm in an invitational neighborhood group, and it's just for people in our neighborhood. So I'll look at it again and remind myself how it all works.
Okay.
We still would have to we'd still, I think, have to be the ones to publicize it so that people would know about it.
Mhm.
Okay, I'll work out the details with her.
I mean, the starting place with that can be the positives that we know about. Notifying the positive results that we've been informed about.
Right. And then we could say that this group has been set up and it's exclusive to people who have PFAS findings and are working on filtration.
But since you said we are not entirely up to date on being informed about who might have a positive result.
You know, I think that let me be more specific about that. When there's a positive result, I think we get the information fairly quickly, not as quickly as the homeowner, but fairly quickly. It's the negatives that we're not getting, and maybe the low numbers, you know, under 20, that we're not being up to date on. And I just know this anecdotally because I hear from some people that they know that their test was negative, but I've never heard about them. Right. So I have no idea how many have been done that we don't know about yet. And because we didn't get a list of what addresses they had chosen for testing in that first round. So I have no idea who, you know, and we would really like to have that so we can get the same kind of picture that they have.
Right.
I'm
wondering with this subgroup if someone were interested in joining, but it was only for people who exceeded the threshold, would you be put in the position of asking them to divulge their score in order to join, or not you, but whoever's the moderator?
That's a good point. And I think that possibly even the people who don't reach the threshold but who do have PFAS present might also want to do that. Yeah. Well, that's a good point. That's kind of why it seems like we should be the gatekeepers on it. You know,
I know of someone whose level was 12, so not above that 20 that is considered to be, you know, officially elevated, but they were told by Jody Cutler from UMass that they should, even though they didn't reach 20, they should consider installing a system. So
yeah, so there will be people interested in talking to their neighbors, even if they don't have the magic.
So those low positives.
Yeah.
Yeah.
Right, yeah, I would think that anybody with a positive of any kind that is thinking of putting in a filtration system would be eligible to join this group if they wanted to.
Yep.
So what I'll need to do is rediscover or reinvent the Board of Health password for Nextdoor because I have no idea what it was. And maybe use that Board of Health Nextdoor account to set this up. So it'll be a little, I'd rather it not be my personal Nextdoor. Not that I ever use it. All right, well, I'll work on it. And we'll see. So do we have any more to say about PFAS?
Was there on Pelham Hill, was there sort of known site there?
No.
Huh.
No, it was not. It was not anticipated. You know, the two areas that we had originally had the positives in were areas that DEP had flagged.
Yeah.
But they didn't have anything for out Pelham Hill Road. Now, the person said that she's, you know, as the crow flies, it's less than 2 miles from maybe it was 1 mile. Anyway, somewhere between 1 and 2 miles, I think, from the fire station. So she's not sure if it could have come from there. That seems long, but something she read said that it's theoretically possible. However, as I pointed out to her, and she knew perfectly well, as we all know, back in the old days, people used to just throw their shit in the woods, and there's little dumps and stashes and stuff all over the place, right? So there could be something like that out there.
Yeah.
It's kind of mysterious where it comes from. Okay, we ready to move on?
Mhm.
All right. So are you guys up to date on the mosquito spray opt-out thing?
I think so, but I don't know what I don't know. So
Right, unknown unknowns. So our request to opt out of mandatory spraying was denied. And I would have felt that it was because our alternative plan was not adequate. But Joe Comerford's office has been following this, and what they found was that, and in fact, Becky went to a meeting where she watched this. She said it was utterly disgusting. The EEA basically rejected any opt-out request in areas that have been deemed to have moderate or higher risk. So basically, they said, you know, have an alternative plan. We're not going to give you any guidance about what the alternative plan is. We had to scramble to come up with an alternative plan. Mine was actually late because I forgot about it, but only a day or two. And then basically they didn't care what the plan was. They just rejected any plan that was in a community of what they considered moderate risk.
Mhm.
So Joe asked them to reconsider this. They said no, and that's kind of where we are. I think it's pretty unlikely that we're going to get sprayed. However, there hasn't been any significant mosquito-borne disease activity that I've seen. Has anybody looked at the most recent mosquito arbovirus stuff? Garrett, have you seen that?
I haven't been following that as closely.
Okay, yeah, right, yeah. I didn't look at the most recent one, but I looked at one not too long ago, and there were basically no cases of anything and few mosquitoes testing positive for the diseases of concern. So, and we're, now into August, and there's plenty of time left, but my guess is that it's not going to be an issue. Let's hope so, because people are going to be really freaked out. So that's the deal with that. There isn't really anything we can do about it.
But I did read that Joe Comerford's office is working on some pushback about this sort of blanket denial that was issued.
Yes, and in her letter, she referred to something that was instituted, something about mosquito control for the 21st century or something like that, and it's going to address all these issues in a much bigger context. And I'm not sure exactly what they're going to do or how they're going to do it, but she's kind of got this in her sights. So next year, ideally next year should be different. That we'll have a kind of different attitude on this.
Okay. I'm checking the arbovirus update right now.
Oh,
and
great.
There's absolutely none of the counties in the state is anything but remote risk for EEE. And for West Nile virus, only Suffolk County is moderate risk. The whole rest of the state is low.
Yeah, so what's with this moderate risk business? I mean, that's what I don't understand.
They're leaving their options open, right?
Yeah.
Yeah, I think they're basing it off of the previous season.
Mm-hmm. Well, that would make sense, although I don't know if we
Probably,
ever reached moderate risk last year. I thought we were always low.
Yeah, and because I think with EEE there is it's like a 3 or 4 year period that
right.
you run through this, and
yeah, this is the third year of what is usually a 2 to 3 year cycle, and those 2 to 3 year cycles used to be like 20 years apart, but now they're coming much closer together. So we could still see cases this year. That would not be unusual, but it also wouldn't be unusual if we didn't see any. So let's hope that that's the case, that this turns out to be a 2 year cycle instead of a 3 year.
Yeah.
So there's nothing to do about it. It's just for your information. So we've got things to schedule. Our party is meant to be next Tuesday, rain date next Thursday. It's astonishing to me that it's so soon. It seemed very distant to me. So we need to figure out what we're all going to contribute in the way of food. Or we could just do it at random and show up with whatever. I don't care.
remind me what time are we gathering?
I'm not sure. On my phone, I have 5 o'clock, but I think I just put that in as a random number. Did we set that?
I put a time in there too, but it was probably equally random. No, I did not put a time in at all.
Okay.
I guess it was to be determined.
I guess so. I was thinking, since it's going to be outside on the deck, I was thinking probably 5 to 5:30.
Yeah.
Somewhere in there.
And I would be happy to, there's something I've used before, and then I think there's a couple different versions of this, but what I've used is something called Perfect Potluck, and it's essentially a shared sign up sheet. And I would be happy to create something on that or a similar platform and circulate it.
That would be great.
People can just go on and, I'll make up a list of like suggested categories, and people can sign up for what they like.
That's great.
And I'll check with Noreen as the host as to what time she's comfortable with. How's that? Since she's not
Okay.
here to speak for herself tonight.
Okay,
Okay.
right. Yeah, I don't know. She's gone off to the Adirondacks. I don't know when
I
she comes
think she's
back.
coming back soon. I saw some post of hers that said that today was their last full day together, but I don't know whether she's coming directly back or
Okay.
if there's another stop along the way, but
Okay, but in another day or two, she'll probably be home.
probably, yeah.
Okay. So now this EDS Hot Wash Focus Group, as I understand it, is Thursday morning of next week at 11 o'clock. Are you guys planning to attend?
Yeah, but I'm not sure what, I mean, I've seen the, whatever was circulated by Noreen about like, here's the questions to be considered in advance. And I don't know how many of them really apply to us. It was very,
Well,
how do
yeah.
how do you see this thing taking shape?
Well,
I think it's going to
Lori's-
be, oh, sorry.
No, please go ahead.
I was going to say, I think it's going to be a quick hot wash.
I
Oh,
think so
good.
too.
Yeah.
Yeah, because
Um,
we just didn't do that
Because we
much.
Right,
didn't do
you know-
anything except a little drill.
Right.
I mean, it was a
the-
very nice drill and it went
Right.
very well. And but we didn't do any real event. So. Okay. Well, thank you for confirming. I was also thinking, geez, what is this here for us? What is here for us in this? But okay.
There
Well-
might be some pieces that the fire chief can contribute around PPE that he received directly through MEMA. Because there were some questions about PPE distribution, but
Mhm. Okay.
Yeah, Walter
Yep.
Walter responded very quickly. He seemed to be eager to participate.
Good.
So maybe
All
it
right.
won't be as short as we think.
Good. We'll let him do all the talking.
Yeah,
No,
well,
kidding.
I think he enjoys that. He's the guy who likes to
Yeah,
express his views,
All right.
which is fine with me because I don't really have any. One of the things that I guess I talked with Lori about this, about the fact that, you know, how can we talk about our EDS response when our EDS didn't do anything, because basically we couldn't do anything. And she said, well, that's kind of part of what we could talk about, you know, if we felt frustrated or excluded or whatever, that kind of is part of this.
Yeah.
So the fact that we didn't do things is as relevant as any things that we might have done.
the thing that I would not want to have happen, though, is for it to just be a discussion about how we didn't follow an EDS plan, because quite frankly, two of the people on this Zoom right now did a lot of work. So Kat, you did a lot of work around communications, and Arlene, you certainly did a lot of work around case investigation. And I think that we need to highlight that there were, in this situation, you know, the planning that's been funded for years and years has been to develop emergency dispensing sites, and not around the other things that you do up until you have a countermeasure.
Okay.
Yeah, so I
Okay.
think that we should try to bring forward all of the work that really the two of you did.
And also between Kat, Noreen, and you, Garrett, and myself, there was volunteering at vaccination clinics. So that even though an EDS did not take place within this community, there were regional clinics, and we went out to those regional clinics and did what we could.
Yeah, so I just
Right.
I don't want
Oh,
all
and
of
Wim,
that.
excuse me, I left you out of that,
Yep.
Wim, but you were also
Right, yeah, Wim was in it
volunteering for
too.
clinics.
Yeah.
I'm so sorry.
I just don't want all of
All of
that
us did
work
then.
to get lost just because there wasn't a plan to do it.
Right, okay.
Yeah.
Right, yeah, the whole business about the EDS plan is, you know, they're quite focused on having plans and having things written down and stuff, but the EDS plan seems to me to be just not helpful. And the EDS itself doesn't seem to me to be something that exists except when there is an emergency, right? I mean, we don't, the fact that the EDS is the EDS team is the unit that's being under discussion here seems to me to be kind of irrelevant. I mean, as far as response goes, we responded as a Board of Health, right? We did our communications, and you did your contact tracing and so on. But we didn't do that in the context of an EDS team. We did it as a Board of Health. And I think we were pretty effective, actually. But all this stuff will come out in the wash, literally. But yeah, I think it's going to be fairly short because so much of it doesn't apply to us.
Okay.
I don't think we have anything else that we have to do.
If I have two other things I'd just like to bring up very briefly.
Okay, please.
One is that I asked via email today whether or not the elementary school administration and the superintendent would like to meet with the board, or by that I mean me, but any of the rest of you is welcome to come
Yeah,
along.
I saw that.
Would they like to have a check-in meeting before school starts up? And Jackie Mendonça, the principal, responded enthusiastically about that. So I will look to set that up. But if any of the rest of you would like to be part of that meeting, holler, so I make sure you're kept in the loop about the timing on that.
And,
okay.
And do we have to be cautious about the number of us who are involved in that? So I think it can't be more than 2 of us.
That may be so.
Yeah, maybe even can't be more than one of us in a thing like that. But
Okay.
well, if it's posted, if it would be posted as a public meeting, any number of us could go, and if not, not.
Okay, so once she gets back to me about what time would work, shall I get back to you about having it posted, Kat?
Yes, if
And then
if there's general interest in attending it. I haven't usually attended these. I have confidence in you to do whatever has to be done.
I'm happy to meet and report back. Let's put it that way. But if anyone else would really like to be part of it, then just let me know. And if it's going to be more than 2 of us, I'll get back to you, Kat, about having it posted.
Okay, yeah, that's easy enough to do.
The other thing was just something.
Yeah.
Oh, go ahead.
Wait. Could we stay on this one for a second?
Yes.
There was some stuff. I didn't see too much of it, but I know that there was some stuff on Nextdoor about the mask requirement for the school, and I don't know if we are going to be asked to give an opinion about this. And I was wondering if perhaps we should have just briefly discuss that. I think that my opinion would be that whatever DPH recommends is what we recommend.
It's DESE, right? Not DPH.
Oh, okay. So DESE gets to make that decision. Okay. All right.
Yep.
But presumably they follow DPH and CDC guidance.
They differ from it on some scores. For instance, on the distancing, it's a separate issue. But in a classroom or on the school bus, if it was more than 3 feet apart, then you don't have to count it as a contact. So that's a difference from DPH. So they are closely related on most guidance, but they do differ sometimes. Anyway, the guidance, first of all learning has to be offered to all students in person 5 days a week this fall. There's no hybrid option or remote learning option this fall. So it has to be all in person, Monday through Friday, full days. And then as far as the masks go, no masking is required out of doors. But for K through 6, because they can't be vaccinated, kids need to mask indoors. They are allowed to remove the masks for eating. And when they go outdoors, they can take them off. But when they are indoors and not eating, they need to be masked. Unless there are medical or behavioral conditions that prohibit the masking.
I saw that behavioral conditions, and I don't understand what that means.
So I don't know that we have to understand it as a board. The school,
Okay.
the educators, the school, and the professionals within the school, I'm sure, have their own assessment of each child in terms of whatever behavioral conditions are there. And
I see.
if in the judgment of that school, in the context of all the evaluations they have of that child, that we are not privy to,
Right.
then I would defer to the school's decision on whether that child is given an exception at all. What I was reading on Nextdoor was that the previously granted exception was that the guardian was allowed to come pick up the child at lunchtime a couple days a week. And I presume spend the rest of the day learning remotely.
I see.
But that's not an option this year. In remote learning or hybrid learning is not an option this year. So
Okay.
unless things change with the guidance from DESE, I don't see us as a board being in a position to override what the school has decided. And I
Absolutely
don't know what
not,
the rest
yeah.
of you think, but
Well, it seems to me that, I mean, this is coming down from DESE, a state agency, and we don't have the authority to override or modify their decision.
right.
Agreed.
The other thing that I think is probably playing in here behind the scenes is the teachers union.
Mhm, I assume
And,
so. And they want
um,
them masked.
yeah.
And we
But
can't blame them.
But they're also, again, the exception that I was hearing about being made last spring, was the ability to go home for half the day, a couple of
Mhm.
days a week, and that they're
Mhm.
removing that accommodation
I see.
from this family.
Well, that makes sense.
Not a request from the family to let this kid go unmasked.
Ah,
So I might have
Interesting.
read it
Okay.
incorrectly, and we'll see if it ever gets brought before us, but that was my take on the whole thing.
well, I'm hoping that it won't come before us because I don't think it's our call in any way.
Yeah.
But just in case, it's good to have for us to have a position.
Yeah.
Ready. Okay, great. Thank you. So you had another thing?
One other thing was that when, I think it came to my mind when we had those deluge rainfalls that washed a lot of roads out in
Mhm.
town. And I started to wonder whether or not in the emergency preparedness sector here in town, do we have a shelter plan in place? And I wondered about it also when we had a bad heat wave in June or so.
Mhm.
And especially for frail or otherwise at-risk people without air conditioning, is there a a plan for like a cooling center if we hit 100 degrees around here, or a place for relief, or with these road washouts and people who maybe on Carver Road could not get to their house or something or other? If something like that happens, what have we got in town?
Well,
And I
for cooling, I think they had town hall open downstairs with an air conditioner, but I'm
But
not sure.
Was it publicized?
I don't know.
Because it's one thing if they have it, but it's another thing if nobody knows that they have it.
Well, that's a good point. Well, Garrett sits with the emergency management team.
But only recently. But I think since I've moved here, I remember at least once when there was notice put out about either the basement of town hall or the fire station
Mhm.
that people could go if they needed to. I don't remember which weather event it was, if they needed to
Mhm.
Cool down or heat up.
warm or
Yeah.
Yeah, right.
plug in their
Too
cell
cold, too
phone.
hot.
Right. But
Right.
I do remember at least one time where there was a notice about either town hall or the fire station.
Okay.
Okay. And what about the shelter question? You know, I was thinking that, hey, the road's washed out, you can't leave home, but if you're not home and you can't get
You
there,
can't
that's
get to your
another
home.
thing.
Right.
Yeah.
Yeah, that's something that maybe could come up at
Yeah.
the emergency management team.
Noreen
Okay.
and I can bring it up
And
at the next one.
the getting the word out to members of the community, possibly at times when internet or power is also down. Just how does the communication to people happen that there is shelter somewhere or cooling somewhere or something like that?
So that really it should be information that's out there in advance.
Yeah, or here's who you can call when you need something, if you can call. Yeah,
Yeah, right.
yeah,
Right. Yeah, well, this was what neighborhood safety net was supposed to be for.
yes,
but that
exactly.
just,
And it
yeah.
still, I'm sure, is a matter of neighbors checking in on their neighbors.
right.
Even though the neighborhood safety net is not a thing, but neighbors checking on neighbors is a thing in Shutesbury, and hopefully no one would have gone unnoticed with what they needed. So, all right.
Right, but had to make it a little formal. And as far as a shelter,
Mhm.
that's a tricky matter.
Sure is.
And I know that there are some cots somewhere, but I'm not sure if there is a shelter plan in place where people can actually
Well, when
take shelter.
I was attending last Monday morning's Coffee with a Cop
Oh.
Zoom session,
Uh-huh.
and I typed that question into the question box,
Uh-huh.
and then I had to leave the meeting.
Yeah.
I forget why, but I got a call or something and had to go, and Cliff put the question out in my he just read from what I had typed into the question box. And Kristen Burt just said, yes, we do have a plan, but we've got to get the word out better. I think that, I mean, I did not hear her response, but I believe that's what Cliff said.
Uh-huh.
So she's on that emergency management team as well. So maybe it could just be addressed on that team about how we can collaborate with that, or how the community can be informed about a resource like that if weather or other catastrophes.
Yeah, Noreen and I can bring it up.
Okay.
The committee hasn't met in a while.
Okay.
Yep, but next time.
All right, good. That's all I have.
Yeah, that's the kind of thing that could go in a newsletter so that everybody would get it.
Yeah, it'd be good to do it in if there's going to be one in September, because that's emergency preparedness month. And
that would be good. That would be good to have an emergency preparedness newsletter, essentially, and focus on that. Okay. All right. Is there anything else that we ought to talk about? I
will just update you that there has not been a COVID case in Shutesbury in a long time.
Yay.
Yeah. And there's no one been isolating or quarantining in town for a while now.
That's terrific.
Let's keep it that way. Things are ramping up in Amherst, so.
Are they?
Oh, yes. Indeed.
What do you know?
That they're ramping up. What?
Big numbers or what?
Oh, no, not huge numbers compared with a city or anything like that, but it's just climbing. And, the colleges are reopening soon, so.
Right.
Buckle up. Keep your mask on.
Right. Yeah. Which of the colleges are requiring vaccination?
think all of them.
I thought somebody was
Yeah, I saw
not.
some sort of a headline about how, what was it, Amherst was not. And correct, that Amherst College is not requiring.
Mm.
I know. And here's the other thing is I met the other day with Matt Hart, who's the director of emergency management at Amherst College, and Emily Jones, who's the medical director at their health center, to talk about their contact tracing approaches and blah, blah, blah.
Mhm.
And they were planning on, if they had vaccinated students who tested positive and had no symptoms, they were not going to isolate them. And
Ooh.
I said, wait. And I checked back and got back to them. I checked with epidemiology at DPH because I wasn't sure. Maybe there's some guidance I'm not up to date on or something, but the epi confirmed for me that absolutely not, that if somebody is positive, then they are isolated regardless
Symptoms
of
or
their
no.
vaccination status, regardless
Uh-huh.
of their symptoms.
Mhm.
And so I wrote back that afternoon to Dr. Jones and Matt and said, this is not what DPH is saying.
Right.
And I mean, it's not in my position. It's not my place to tell these people what to do, but I told them there is no guidance from DPH that suggests that you cannot isolate. Plus, they're not having their bubble this year that
Yeah.
they had last year. Last year, Amherst College students were not allowed to leave campus.
So
Mhm.
I just checked with Dean and he said that they are requiring vaccination of staff and students.
Oh, okay.
Oh, good.
Then it's one of the other colleges. It's not. Maybe it's Smith. I'll have to.
And
look.
I think I have an idea that UMass is requiring the students to be vaccinated, but not the faculty and staff.
Yeah, I think you're right. But hopefully Amherst College will change this policy about not isolating positive vaccinated students.
I hope so.
Because God, that could be a mess. All right.
Okay. Well, good to know. All right, you guys. So we all have things to do. Wim and possibly Arlene are going to look into somebody helping out
Yep.
Greg, and I'll ask Ken. And oh, don't forget, and Arlene is going to do a perfect potluck
Yeah.
Yep.
sign up.
Sign up
And
type of
don't
thing.
forget to send it to Al.
Oh yeah. Okay.
We've got meal planning to do.
Right.
That's right.
And and Arlene is going to have a check-in meeting with the school. And Garrett is going to make a note to bring up the shelter plan at the emergency management team.
Okie doke. Sounds good.
Okay. Okay, well,
I will be gone the first meeting in September.
okay.
Sorry. I think that is, sorry, not sorry.
Yeah, I hear you. Right.
That is September 1st. I will be out of, I'll be out of town. I could sign in. I'll have Wi-Fi, but you know, I'm on vacation, so I'd rather not. Okay.
Yeah, unless it's really urgent, I don't
Yeah,
see why you
if it's,
should.
yeah, if it's really urgent, I'll be there. Just let me know.
Okay,
Okay.
okay. So at what point will we decide whether to have the party on Tuesday or to go on to Thursday? There's Tuesday right now says a chance of showers, mostly sunny. Chance of precipitation is 30%, and we don't have Thursday yet.
Uh-huh.
Let's say Monday.
Sure.
Monday we'll decide. I'm going to be away for the weekend, and I will be back at some point on Monday, probably fairly late. But I mean,
Okay.
you know, but not after. I hope not after dark. So it won't be like I'll be out, you know, till 11.
Okay. Yeah. All right, yeah, let's try to decide on Monday.
Okay.
Do you mean after you've returned home is when we'll decide?
Well,
Is that what you're suggesting by the?
you know, it should be fairly obvious, right? If
Yeah,
it looks like it's going to rain on Tuesday, we won't do it.
Yeah,
So, I mean, I don't have to be part of the decision-making
Okay.
process necessarily.
all right.
Okay, that kind of complicates it for the potluck, the whole potluck aspect of it, but what can we do? The
Yeah,
party's outside and,
make something that will keep.
there you go.
Okay,
Or something that you can do at the last minute.
that's right, exactly.
Yeah.
Okay,
Okay,
All right.
okay, well, I'll
Thanks,
see you guys
everyone.
soon. Thank
Stay
you.
well.
Take
Good
care.
night.